first going to start this session with Ivan talking about the anatomy of the PCL. Ivan?
Thank you. Okay. Then the anatomy of the posterior cruciate ligament we talk about shortly, but here we have the posterior cruciate ligament, like an anterior cruciate ligament, will be an extrasynovial and intra-articular ligament. We can see in the posterior surface of the tibia a vertical bone line here and here. This is the origin of the posterior cruciate ligament. This bone line is seen in X-ray and MRI, and this insertion is called PCL facet. This PCL facet, here we can see the PCL facet in an X-ray image. Is a easy structure. This, we say to summarize about this PCL facet. It is easily space identifiable radiologically and anatomically. There is a space between the back of the posterior horn of the medial meniscus, the posterior cortex of the tibia, and the upper edge of the popliteus muscle. His anterior posterior diameter is about 30 millimeters, and the PCL attachment is located in its back half about in 50 millimeters. Here, we have a sagittal cross show us this PCL facet here. And this specimen had a small ligament located anterior to the PCL, a variable ligament, the anterior meniscofemoral ligament or Humphrey ligament. When it is present, we can see here, this is the PCL, and this is the Humphrey ligament. To make a good location of the implant, can see the location of a needle in X-ray image. We can find three options. Number one, too close to the posterior horn of the meniscus. Number two, it may injure neurovascular structures, the lower. And number two is correct, just in the middle of the other two needles, just in the middle of the PCL facet. Edwards again did a study about the shape of the footprint of the two bundles of the cruciate posterior ligament in the tibia and the femur. This footprint, he divided this footprint in two parts, upper and lower. Upper part for the anterolateral bundle, and the posterior and the lower part for the posterior medial bundle. The upper part, with a diameter about 8 millimeters and mediolateral diameter of 9 millimeters, and the lower part for the posteromedial bundle with an anterior posterior diameter of 6 millimeters and mediolateral diameter about 10 millimeters. The femoral attachment is located in the lower back of the lateral aspect of the medial condyle, and it has a fan shape. In this slide we see the knee extended, but we are used to see him with the knee flexed and in the anterior view. This is the image of the attachment. On this slide can see clearly his fan-shaped attachment, and anteriorly we can differentiate it another fascicle. This is the anterior meniscofemoral ligament, the Humphrey ligament, when it is present. These femoral attachments can be divided into three parts when the Humphrey ligament is present. These parts, anterolateral bundle, is the most anterior. When the Humphrey ligament is present, is back and bottom, and the posteromedial bundle is above the two others. We can see on the right the relationship between the PCL, the meniscofemoral anterior ligament, and the posterior horn of the lateral meniscus. To conclude, the posterior bundle is relaxed. Here we have a sagittal cross with a knee flexion. The posterior bundle is relaxed with the flexion of the knee, and the anterior bundle, this bundle, is strained just like Humphrey ligament. This anterior bundle is strained, and the Humphrey ligament too. And when the knee is in extension, we can see that the posterior medial bundle, this is the posterior medial bundle, is strained when we do the extension of the knee, as the posterior meniscofemoral ligament is present, the Risberg ligament. Here is the Risberg ligament, and here we have the posterior medial bundle. Thank you very much.